Hi, my name is Alex Erskine, and I'll be doing an NATA position statement on anabolic androgenic steroids. The literature dates back to about 6,000 years ago, where they extracted testosterone from canines and inserted them into guinea pigs. And they suggested in about 1935 that testosterone was a stimulant to anabolism, which is the buildup of tissue, and the testosterone is going to increase somebody to get the guinea pigs in that instance stronger, faster, and a little bit more aggressive at that time with those animals. The first commercial available AAS in the US was Dianabol, and that happened in 57. And then they found abuse through the 60s and 70s. And in 67, doping oversight within the Olympics, because they noticed that there was about too many athletes using it, so they started to crack down on it. And then in 2004, there was an Anabolic Steroid Control Act, which trickled down into college athletics. And then it was classified as a powerful Schedule III pharmaceutical. The implications of steroids is a decreased immune system, increased sebaceous glands and sebum, which can cause increase of acne or dermatological issues, and an increase in mouth issues such as gingival tissue can increase in size and encroachment, and it can also alter the mastoid, which is going to lead to TMJ dysfunction long term. And in this, males and females, you can see below some of the issues that they have. Within males, most of this is reversible, whereas in females, most of it is not reversible, unfortunately. And that is the difference between the males and females below in that table. The recommendations for healthcare professionals and for our patients are to make sure that we know the therapeutic versus non-therapeutic uses of steroids and to be aware of the signs that we're watching for within athletics. This means that we need to know the signs and symptoms of what we're seeing in athletes, or just keep an open ear out for listening around and hearing what patients are talking about. This also means that we need to keep an open, honest, and evidence-based dialogue when speaking with stakeholders. So this means that we all need to be on the same page of where we stand on steroids. And also, there are research that shows that a well-designed program might effectively inhibit abuse in adolescents, but this is gender specific, so there needs to be one for males and there needs to be one for females, and making sure that we are educating both patients on the abuse of steroids. And it does show, research shows that abuse does occur higher in males than females. So this means that your male sports you need to keep a greater look at, but do not neglect looking at your female sports as well. Some interventions that show are frequent screening for athletes, which means that they can do drug tests such as urine or blood samples. There are also education on identifying abusers and potential abusers. And this sort of begins at body image issues that we can see within patients who do utilize steroids. So it would be useful to utilize a body screening image tool at PPEs, and to see if you have any athletes who could be at higher risk of AAS abuse. Thank you so much. I hope you learned something.